Hello everybody, I'm Dr. Satyan Mehta. I'm a spine surgeon here in Mumbai. I have made this video for patient education purposes for explaining about what a lumbar disc herniation is, which we commonly, lay people commonly call as a slip disc, what the treatment is and how you can prevent it. So I'll just explain a little bit about biomechanics and what a slip disc is. Now, if you see, this is the spine, this is the neck, the cervical spine, the back, upper back or the thoracic spine, and the lower back, which is your lumbar spine. Now, in this spine, we have, if you see from the side, you have these bones, and in between there are discs. The disc is responsible for all the movements which occur in the back, and behind them is the space where the nerves exit from the back. These nerves go from the back down into the legs and give strength and feeling in the legs. And they are responsible for all the sensations and the power, as I said. Now, all the movements occur here at the disc level, and there are two joints at the back which are called the facet joints. And so the movements here, which are normal flexion extensions, the whole center is at the disc level. Now, as one grows older, sometimes the disc gets a little weaker and it can tear and come and press on the nerve at the back. So if you see, this is the disc here, and this is the sac of nerves. Now supposing this disc tears and it can come out and press the nerve at the back, and if that happens, then the person gets a lot of pain in the back, which may shoot down, radiate down into the leg as well, as is happening over here. And this is what a lumbar disc herniation is, or a slip disc is. Now, why does this happen? This is because, when you are born, in a child, the disc is very strong, it is well hydrated, but as one grows older, the disc starts getting degenerated or worn out, and extra bone starts forming around it, and then these tears sometimes may go across onto the edge of the disc, and the central part of the disc, or the pulposus part, may come out and start pressing on the nerve, and that is what a herniated disc is. Now, how do you treat this? If a person gets this herniated disc, how do you treat this? Now, usual early treatment is quite easy. It is simple, nothing to worry about. You start with rest, you give painkillers, sometimes physiotherapy also is given, and all this normally helps. And about 80 to 90% of people get better with lumbar disc herniations with only these measures. Uh, Sometimes, when they are not improving, we may even give corticosteroids and even injections or root block injections in the back, which are also steroid injections. But for these, please consult your doctor before you go ahead and just take this, because there are only certain conditions in which it can be given. Sometimes, when there is severe pain in the back, uh, and a person is not getting better in spite of all these medications, then surgery may be required. Now, there are certain conditions in which surgery becomes very necessary or very urgent. Which are these conditions? Sometimes when there is weakness in the leg or the foot, in that condition you need to operate quickly to get a better result. And a very urgent or emergency condition is when the urine stops, when a person is not able to pass urine. This may be because the nerve compression is so bad that the nerves for passing urine, those nerves which are your S2 to S4 segments, start getting damaged, and that is a urgent condition where you need to operate this quickly to save the bladder. Now, surgery, normally we do a micro decompression here. So what we do in a micro discectomy here is that we go in from the back and we go straight on the nerve which is getting compressed, and the part which is extruded out pressing on the nerve is removed. Now, this is normally a very simple surgery. It takes about 30 to 60 minutes. Usually we use a microscope in that, and there is immediate relief, more or less, in this. And it's a very routine and safe procedure, so it's nothing to worry about. Now, how do you prevent this? You would want to prevent getting a herniated disc. which are your risk factors which can cause that? Number one is the people, if you are having a sedentary lifestyle, sedentary occupation, you are at a higher risk to getting a disc herniation. Smokers have a higher risk. People who are have higher body mass have also have a higher risk, and people who are using very heavy vibration equipments, those are sometimes have a higher risk as well. So the way to prevent this is, number one is most important here is to maintain a very healthy lifestyle with regular physical exercises and back exercises. This would prevent disc herniation from happening. And also, even if it happens, that could get relieved much faster if you have regularly been exercising. So I thank you. I hope that you have understood a little bit about herniated disc, and I'll try to send more videos about other spine conditions as well. Thank you.